Hello, everyone. Welcome back. Thank you so much for your amazing response to our previous podcast. In previous podcast, we discussed about soft contact lens fitting, and today we are back with another great topic, which is soft toric contact lenses. So let's get started. Sir, as you know, our topic is soft toric contact lens. So let us know the main difference between spherical soft contact lenses and toric soft contact lenses.
Thank you so much, Kashmala, and welcome back again. The main difference between spherical and toric lenses, you know that in spherical lenses, the power at the whole lens is the same. If a spherical lens of +2 diopters, for example, and if I rotate that lens from this direction to this direction or this direction or this direction, in any direction, the power which is +2 will be the same in any direction, right? But comparatively, in toric lenses or in a cylindrical lenses, you know that in astigmatism, there are two principal meridians, right? One is called the axis meridian and the second one is called the power meridian. There are only two meridians in astigmatism, right? So in a cylindrical lens, we have two meridians, like one is power and other one is called the axis, right? And you know very well, axis and power meridians are always 90 apart from each other. If power is at 90 degree, the axis will be at 180 degree, right? There is a difference of 90 degree between power and axis. So for example, if I wear glasses and for example assume that these glasses are spherical lenses, right? If I put glasses like this, the power will be the same, and if I put glasses like this, the power will be the same. So in any direction, the power will be the same in spherical case. But for example, if it is a toric lens or a cylindrical lens, if I move the glasses from this direction to only this direction, the visual acuity will be blurred, right? Why? Because I rotated the axis, right? So this is the main difference between a spherical lens and a cylindrical or toric lenses. So same as in contact lenses, right? So when, for example, if I blink and with my blinking, contact lens rotates, the axis will be, rotated. And if axis rotates, you know that the vision will get blurred. So this is the main difference between a spherical lens and a toric lens, or a spherical lens or a cylindrical lenses.
Sir, why do the astigmatic contact lens patient complains more when soft toric contact lens fitting is inappropriate?
As I said earlier, Ms. Kashmala, that even a small rotation of a toric contact lens can cause a rotation in the axis. And when axis rotates, the whole vision will get blurred, right? The main problem, right? The main disturbance in the toric soft contact lens fitting is lens rotation. So whenever you insert the toric contact lens in the patient's eye on the surface of the cornea, you have to be very careful.
Sir, my next question is, what should be checked before fitting the soft toric contact lens?
Very nice question, Ms. Kashmala. We have to take care of so many things, before inserting a soft toric contact lens on the patient's cornea. The very first thing is we have to perform a full-fledged refraction, a best corrected glasses prescription. So accurate prescription is required, like the best corrected spherical correction, best corrected cylindrical correction, the best corrected axis, the refined axis, and the K readings, the K1 and the K readings for the base curve, and the diameter of the soft toric contact lens. So these are very important things. And moreover, the lid tension, the upper lid tension, and the tear film stability, and the blink control or the blink pattern. These are very important factors which we have to take care before inserting, the soft toric contact lenses.
So you talked about the base curve and diameter of the soft contact lenses. So what do you think? Do we have the same criteria for selecting the base curve and diameter for spherical soft and toric soft contact lenses?
Yes, Ms. Kashmala, the criteria or the mechanism for selecting the diameter and the base curve in spherical soft contact lenses and the toric contact lenses is the same, but a little bit change. Selection of diameter, very well, we add 2 millimeter in HVID, and after that we get the total diameter. But in case of toric soft contact lenses, the diameter must be a little bit bigger than the HVID plus 2 mm, right? So for example, if HVID 12 mm, we add 2 mm and the resultant will be 14 mm. But this 14 mm is total diameter in soft spherical lenses. But when we select the diameter for the toric contact lenses, we will add some points in the total diameter. Like if the total diameter with HVID and plus 2 mm is 14.5, we will not select 14.5, but we will add some more points. Like we will add, it will be 14.7 or 14.8. And why we are doing this? We are doing this to avoid the lens rotation, when we will insert a toric contact lens in the patient's eye, the biggest problem in toric soft contact lens fitting is lens rotation, So when we will add more values in the diameter, so bigger diameter will avoid the lens rotation. And if we talk about the base curve or the BOCR in soft toric contact lenses, the criteria or the mechanism is the same. Like we get K1 and K2 readings, right? And we add 0.8 millimeter in the 0.8 millimeter in the flattest K reading. For example, if we have K1 7.5, K2 is 8, so 8 millimeter is more flatter, right? So we add 0.8 into 8, so 8 plus 0.8 will be our base curve for the soft toric contact lenses.
Sir, as you said, the lens rotation is the biggest problem in soft toric contact lens fitting. So how can we avoid this lens rotation in soft toric contact lens fitting?
So we have laser lines or laser dots on the toric contact lens at inferior side or at 6 o'clock position. So for example, if you insert a toric lens in the patient's eye, and if after settling period, after 10 to 15 minutes of settling period, if that dot or these laser lines are at 6 o'clock position, right, it means that your lens is well centered, your lens is fine, the axes are at its appropriate position. But when the patient blinks and that lines of that laser lines are moved, from 6 o'clock position towards the left side and towards the right side, for example, this is a problem. So for example, if I'm a practitioner, a contact lens practitioner, and you are the patient, and your contact lens, for example, this is a contact lens, right? If it is moving from this is 6 o'clock position, and if the lens is moving towards this side, like this, so this is my left side, right? And if this contact lens in the patient's eye, it is moving from towards this side, this is my right side. So for example, if this is a contact lens, right, this is patient contact lens, and I'm a practitioner, we are facing each other, right? So for example, this is 6 o'clock appropriate position, right? And if patient blinks, and with the blinking, lens is rotating towards this side, and this is my practitioner's left side, and this rotation is called left side rotation or clockwise rotation, right? In this case, we will add some axis in the spectacles axis, right? And if the contact lens is moving toward this side, towards the right side of practitioner, this is called the anti-clockwise rotation, right? So we will subtract some axis from the spectacles axis, right? This is called the LARS rule, right? LARS mean LA and RS, right? LA mean if the rotation is towards the left side, we will add LA, left add, right? And RS mean if rotation is towards the right side, we will subtract. RS mean right, subtract, right? So if the rotation is towards the left side, according to with respect to the practitioner, we will add the axis. And if the lens rotation is towards the right side, we will subtract, right, the axis.
So you talked about the LARS rule. So let us know what will be the conditions in which we apply LARS rule in soft toric contact lens fitting.
So you are talking about the indications and the contraindications of the LARS rule. For example, when we insert a contact lens, a toric contact lens in the patient's eye, and when patient blinks, right, if the contact lens rotates somehow and will regain its position again at the 6 o'clock position, it means that there is no any need to apply the LARS rule. What I said, if we insert a contact lens, toric contact lens, right, and if that toric contact lens is at its 6 o'clock position, the appropriate position, right, and when patient blinks, lens somehow rotates and come back to the original position, it means there is no any need to apply the LARS rule, right? So this is the contraindication. In this situation, we will not apply the LARS rule, right? But your question was in which conditions we will apply the LARS rule, right? LA mean left add, RS mean right subtract, right? So we will apply LARS rule if condition number 1, if lens is at its 6 o'clock position or normal position or appropriate position, and when patient blinks, right, the contact lens is moving towards the left side with respect to the practitioner or the clockwise rotation, right? If this is happening, then we will apply the LARS rule. For example, the axis of this prescription of this or this patient are 90 degrees. And when the contact lens is moving towards the left side with respect to the practitioner, we will add, few axes, 10 to 15 degrees axis in 90 degree. So new axis will be, if we add 10 degree or 15 degree into the 90, it will be 100 or 105 axis. And if this is a contact lens, and right now it is at 6 o'clock position, at normal position, and if it rotates towards the right side or anti-clockwise with respect to the practitioner or contact lens practitioner, we will subtract the axis. For example, the axis of that patient are 180 degree, and the lens is moving towards the right side. It means we have to subtract the axis from 180 degree. So the new axis will be, if we subtract 10 degree or 15 degree from 180 degree, it will be 170, or it will be 165 axis.
Sir, how do we know that how many axes we have to deduct or add in patient's prescription?
So the calculations are very simple. You know very well that in a whole circle there are 12 clock hours: 1 2 3 4 5 6 7 8 9 10 11 and 12 clock hours in a one circles. And you know very well we have 360 degrees in a whole circle. So 12 clock hours in a circle and 360 degrees in a circle. So if we want to calculate the degrees of 1 clock hour, so for example, if this is a 6 o'clock position, right, and the lens rotation after blink is from 6 o'clock position to the 7 o'clock position, and lens is not coming back, right? The rotation is consistent, right? So we have to apply the LARS rule now. If the lens will come back, we will not apply the LARS rule. So for example, lens is moving from 6 o'clock position to the 7 o'clock position, and the lens rotation is of 1 clock hour from 6 to 7, the 1 clock hour. So we have to know, we have to rule out that how many, the degrees in 1 clock hours, right? So for that sake, we know that in a whole circle there are 360 degrees, right, and 12 clock hours. So we will make 360 over 12. The answer will be 30. So 30 degree means if the rotation or the lens rotation is from 6 to 7 or 1 clock hour, we will add 30 degree, or we will subtract 30 degree. For example, if lens rotation is towards the left side, we will add 30 degree in the axis. So if the lens rotation is towards the left side of 1 clock hour, we will add 30 degree, right? We will add 30 degree because the lens rotation is towards the left side with respect to me, with respect to the practitioner. And if the lens rotation is 1 clock hour towards the right side, right, according to me, according to the practitioner, we will minus 30 degree, right? So this is the whole concept of lens rotation and how many axes we have to add or subtract, right? Either it is the rotation is towards the left side or rotation is towards the right side.
Sir, as we talked about, the biggest problem in soft toric contact lens fitting is lens rotation. So what do you think, what are the main manufacturing techniques through which we can avoid the lens rotation?
Yes, there are so many techniques. There are so many manufacturing techniques. With the help of these techniques, the toric soft contact lens can maintain its normal, its appropriate position, right, which is called the 6 o'clock position, right? So the techniques are, the number one technique is the prism ballast technique, right? Then the second is the peri-ballast, and the third one is called the truncation. So if we talk about the different techniques.
Sorry to intervene, sir, but can you please explain these techniques?
Yes, for sure. We have, as we discussed, that there are 3 different techniques. Number one is called the prism ballast, right? It doesn't mean that we have prism in the soft toric contact lenses. No, prism ballast mean the technique is prism ballast. If we talk about the prism, we have a thick area which is called the base, and we have a thin area which is called the apex, right? So this prism ballast technique applied in such a way that the contact lens, the thick area or the 6 o'clock position, right, it is weighted, like the weight of that inferior area of the contact lens, right, the 6 o'clock position, the inferior side of the contact lens is behaved like a base. So that inferior area of the contact lens, or the part of the contact lens which is at the inferior side or 6 o'clock position, right, this is heavy. So where gravity will apply, right? So the contact lens will get centered at a 6 o'clock position, right? And that contact lens will follow the axis. So this is how the prism ballast technique will apply. the heavy area will come down at a 6 o'clock position. And when the heavy area or the inferior part of the lens will come down, the lens will follow the axis. And the second technique is called the periballast. In periballast, right, the lower portion is actually the periballast is the modern technique of the prism ballast, right? The technique is the same. The heavy area, right, the heavy portion or the heavy part of the contact lens will come down because it's heavy, right? So gravity will apply and it will come down and the axis will follow, right? And the third technique is called the truncation technique, the truncation manufacturing technique, in which no gravity will apply, no weight of the lens will apply. So how we can make a truncation process in soft toric contact lenses? This is that lower portion or the lower part of the contact lens, of the soft toric contact lens, or the 6 o'clock position, the lens will get flattened at that point. Rest of the lens will be steep fit, and that inferior area of the contact lens will be flatter, right? So the lens in this situation, the lower part is flatter and the upper area is the steep fit. So if the lower portion of the contact lens or the 6 o'clock position of the contact lens, that specific part is flat fit, rest of the portions of the contact lens is steep fit. So in this situation, the lens will follow its proper axis or appropriate axis.
Thank you so much, sir, for your precious insights on soft toric contact lens fitting. That's all for today. Feel free to drop your questions in the comment section, and let's meet again in the next podcast.